Hello.
You're supposed to look at that camera, not the...
Oh no, I'm supposed to look at this camera. This is the main camera. So I just wanted to, I guess this is kind of a whole video series because there's a lot to talk about. Currently, I have 35 pages of research about coronavirus and the related topics, so we're not going to cover all of that. So in this video, we're going to be covering some basics like what is COVID-19, where did it come from, what are the symptoms, what to do if you're sick, and what to do if you're on lockdown. And then we're going to bust some myths. Right now, I'm going to throw the 30 days to slow the spread guidelines up on the screen as I go over some disclaimers just for anyone who's unfamiliar with them. The situation with coronavirus is rapidly changing, so just understand that this video was made at the very beginning of April, so things are going to change, projections are going to shift, and caseloads and percentages will increase. Secondly, just so you know, I'm going to throw some sources down in the description. It's going to be in the form of a whole entire document with linked sources. And I also want to say this for this video, but also all videos moving forward. We do not care who you vote for or whether you like Trump or whether you hate Trump. Our only goal is to expose truth, no matter who that favors. All that said, the most important thing to do right now is to combat COVID-19, so I want to start with sharing some general information. So what is COVID-19?
It's a virus. So COVID-19 stands for Coronavirus Disease 2019. As far as we can tell, it came from some sort of like markets in China where the sanitary conditions might not necessarily have been.
Like seafood markets.
Yeah, places where it's difficult to keep things super clean and stuff. Symptoms are fever, shortness of breath, in severe cases, extreme shortness of breath. You have pressure in your chest, your lips can turn blue, and if you're experiencing that, that's, some severe...
That's the time to go to the doctor. Or call the doctor, rather. We're kind of focusing on telehealth now with the virus.
But otherwise, preventing it, you need to focus on... Now they're saying that the main way that it spreads is by touching contaminated surfaces and touching your face. So...
Technically, are they saying that for sure, or are they saying we're... kind of like not
I think
sure.
What they're saying is they don't really know, so you should wash your hands. Don't touch your face, wash your hands.
Right.
Don't sneeze on people. Don't try and breathe in people's sneezes.
Don't try. Don't actively breathe in.
Don't go around smelling people's sneezes. Also, did you know that sneeze experts exist?
I did not.
They do. People literally
What do they do?
Study sneezes. But anyway. If you are sick, like we were saying, telehealth.
Yeah.
Call the doctor. Don't just go in because you could spread it to other people. So call the doctor, tell them what's happening, and they'll inform you what to do from there.
Yeah. And the biggest thing is just not being exposed in the first place.
Yeah.
Like, if there's any way that you can, don't leave your house.
Yeah.
Which is what we're kind of all doing. I think Corey has been in this house. Corey is my husband and our producer. I think he's been in this house. We looked at his phone where it like tracks how much time you spend in different places, and he's been here for like a month and a half. Oh, I kind of want to circle back to the risk. So it's specifically people who are 65 years and older, people who live in a nursing home or a long-term care facility, so they're around a bunch of older people, and then people of any age. So we've actually seen a couple of younger people get sick. It's not like the flu where young people are especially at risk, like super young people, but it has been seen in all age groups if you have underlying conditions. Chronic lung disease, asthma.
Pause. Sorry. I don't know. What? It didn't even make a sound, right?
Does that mean it was never on?
No, it was.
literally any age group. If you have underlying chronic lung disease, asthma, heart conditions, if you're immunocompromised from smoking, having cancer or cancer treatments, organ transplants, HIV, AIDS, prolonged use of corticosteroids or other immune weakening medications, if you are severely obese, if you have diabetes, chronic kidney disease, or as my notes say, chronic kidney disease, or liver disease. So that's a lot of different things. They're really not seeing hardly anyone under the age of 30 having major complications if they don't have underlying diseases, but there have been a few. So we can't say it's like 0% chance. Like some people have gotten severely sick without anything underlying. No, you're fired.
Oh. Okay.
We rolling?
For now.
Okay, so we're all on lockdown. Maybe not everyone, but
should be on lockdown.
should be on lockdown, even if that's not required by your local government. So what can we do when we're on lockdown? You should. These are different suggestions mashed from social media and from the actual CDC itself. Take breaks from watching, reading, and listening to news stories, including social media, because hearing about the pandemic repeatedly can be upsetting.
You really followed that advice.
I know.
We haven't spent 12 hours for 5 days straight researching this.
No, not at all. Take care of your body. Take deep breaths, stretch, or even try meditation or yoga. For a lot of people, they're going to have a lot less time because they're trying to work from home and do school from home for their kids. But for people like me who are just kind of don't have anything to do other than research for 50 hours in a week, it's a great opportunity to like try new things and like focus on taking care of your health, because normally we're just go, super stressed. Another thing you can try to do if grocery stores have food, try to eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, and avoid alcohol and drugs. Going outside is not only safe, but recommended as long as you're still social distancing. Many locations still have parks open to the public. Just maintain your safe distances. I know some places are having to close the parks because everyone's gathering there. And I think they've been trying to keep golf courses open too. Getting ready for your day by showering, getting dressed, and putting on makeup, for some people, helps some people feel a sense of normalcy. If you're finding more time on your hands, try to look at this as an opportunity to explore something you haven't normally had time for. Maybe picking a new hobby or reading a book that you bought that you haven't gotten to read yet. If you're finding less time on your hands, try creating routines and schedules for help keeping things manageable. Lots of helpful articles are popping up about this because a lot of people that's really ringing true for them, where they're kind of overwhelmed. To get a break from being in the house, it's really cool. A lot of neighborhoods have started doing this thing called a teddy bear hunt. I don't know if you've heard about that,
I think I have.
but people will actually put teddy bears in their windows so that parents can take their kids around the neighborhood, either driving or walking, and look for the teddy bears and just have something to do. And another big thing is connecting with others. We can't see each other face to face, but we still have FaceTime calls and Zoom meetings with friends. And I think is there a Netflix party app?
Yeah, I saw that.
So you can actually watch Netflix at the same time as your friends. And plugging into church online or scheduling times to kind of do things simultaneously with your friends kind of gives you a sense of engagement with other people, even if you can't see each other. And just knowing that one day this will all be over. Sharing facts of what we do know and what we can do today will help us move forward because it gives us something to do. Speculating about what might happen and forecasting what can go wrong isn't encouraging or productive, as Fauci says. Whatever happens, we'll come out the other side and build our lives back up. If you have family, treasure these moments together. It's kind of rare that we get a chance to spend time together, and this is the perfect opportunity to put family first and kind of not worry about, these things that I have to get done. Like right now is the perfect time to say, you know what, family's not interrupting my work, or getting this schoolwork done isn't interrupting, it's the school and the work that are interrupting your family relationships. If you're feeling that stress point, like, we have to value the relationship over the work that has to get done. Like, we're all shifting so much that that's totally acceptable. Now, what we're projecting isn't super important necessarily, because as Fauci says, it's not super helpful necessarily to project. But at the same time, everyone's wondering, how long are we going to be in this and how many people are going to be affected?
Yeah, okay. So basically, the professionals, Dr. Fauci and Birx, which, can I just say, I don't know anything about her, but Dr. Birx seems kind of cool. I'm not sure what it is.
I feel like she's like somebody's like really cool aunt or something.
Yeah.
Like.
But anyway, they've been shown to be saying that 100,000 to 200,000 Americans could die from this. That might not happen. They've also been saying, models aren't always true. They don't know. Often they're not correct.
Right.
But it's not really something you need to focus on too much. You just need to focus.
That's just their best guess.
Yeah, you need to focus on keeping yourself safe and the people around you safe.
Right.
Instead of focusing on worst case outcomes.
Yeah. As far as how soon it's going to be over, we don't really know. But Fauci's been saying on multiple occasions that he thinks it'll be over probably sometime around April. We'll be peaking and slowing down, at which point it'll kind of die down for the summer and then maybe cycle back through in fall, which is kind of more weather-based, whereas Birx was almost alluding to the fact that we might go a little bit longer than April, just because instead of starting in November and going to April, like most sicknesses, we started in really the beginning of March. So she's saying it could go through the summer, but he's saying it could just go through April. We just don't know.
Yeah, because I'm sure it depends on all kinds of different things.
No, and we don't have prior data to even know. Like,
when
we
do you
have
start
no idea.
counting? December or
Right.
February, March, when?
Yeah. So I also want to go over how the government's responding, because I feel like there can be a lot of despair whenever we think that our government is not helping us and we're just kind of like being sheep led to the slaughter. Like, I feel like there's a lot of despair going around about how awful our leadership is. And there's a lot of too much hope, if you can have that. Like, people almost getting so hopeful that they're not caring enough about what's going on to take action. And that's...
I feel like it's less hope and more apathy almost.
Right.
It's like, it's not going to get that bad. I'm not really concerned.
Yeah. So, definitely don't want to encourage that. So we'll kind of get into this throughout this and the future videos that I want to do. We're not getting too deep into it today, but the government has been super involved from the very beginning. I think it's extremely important to understand that the response should not only be coming from the federal government, though. Like, it's not only our local, like, city and state, our governor's responsibility to help us and to guide us through this pandemic, but it's also us as individuals, like people stepping up and making face masks, people stepping up and saying, okay, my company is going to do this, or my family is going to do this, and then people who don't have those resources just staying home. Yeah. Like, I know Dr. Birx has emphasized that from the beginning. Like, she's always been saying, like, we need to do our part. And the millennials, like the bulk of the people right now, need to be leading the way and the example, and sharing that it's so important right now to not be exposed and not spread it. I'll try to keep this brief since we'll also be going into further detail later, but our government has vaccine trials underway, medicine trials. They're working directly with governors to meet their needs through funding, legislature, and shipment of supplies. Another huge thing they've done is leveraging the private sector, which I thought is really cool, and including every industry in the conversation to make sure everyone's heard and that all of the needs are met. The vaccine is coming around at record speed, but even at that pace, it probably won't be ready for another 1.5 years. Several drugs are being tested as well, and the government has done a total overhaul to many protocols to try to fast track the response to the virus in a ton of different ways, including trying to get large-scale testing out. Testing is widely available and has been for some time. They were initially having some problems with testing, not with the availability, but with knowing how to push it out to the people. Like, they had the tests physically in stock, but they didn't know how to get them to the people. And then there was the issues of once they did get to the people, like how quickly they were being run to get the results. They had to back up. So the testing has not been great, but they're doing all they can, which is pretty incredible considering how fast all this has developed. And now it's time to must some bits.
Yeah, myth busting.
Will you lead us through the WHO article?
The WHO.
The WHO.
The World Health Organization. Yeah, so we're going to take a look at some common myths.
Okay.
And when I say common, I mean common.
Oh boy.
I cannot stop seeing them
Oh no.
everywhere, constantly. I'm just like, I know that these people are trying to help other people, and like it's really good intentions, but it's not true.
Yeah.
And it makes it worse in the end. So just lots of fact checking is necessary. First one is being in the sun or warm temperatures doesn't prevent the virus.
Yes. Don't go sun tanning just to get rid of the virus.
Yeah, no. It's healthy to be in the sun. Like, it's good for you in general just to be in the sun.
Get some
and
vitamin
go
D.
outside, but it will not directly prevent the virus. Another one is that you will have the virus forever.
Oh my.
Yeah.
I mean, viruses do become a part of your DNA, I'm pretty sure. So technically, that's probably where it came from, is that
Maybe.
you technically have it written in your DNA, but that doesn't mean it's active by any means, or could reactivate even.
Yeah, if anything, it might even be better that you have it.
Yeah.
Because
then you've already had it.
So yeah, you will recover. It's not going to be with you forever. This is one I actually saw quite a few times. Being able to hold your breath for 10 seconds or more without coughing or feeling discomfort doesn't mean you're coronavirus free.
Wait, what?
Oh yeah, I've heard this a few times from different people. Once again, trying to help other people, but...
Wait, so what is this false test? What are you
Basically, they're saying, oh, if you can hold your breath for 10 seconds and you don't experience discomfort or anything, then you don't have it.
Interesting.
Which I kind of get the logic there, I guess, but it's not true.
Yeah.
So, yeah,
Several people are asymptomatic, right?
Yeah.
Oh, yeah.
So,
Yeah, it's definitely not. Drinking alcohol doesn't protect you against coronavirus and can actually be dangerous. Fun fact, I'm pretty sure that alcohol sales have gone up 40% during this.
Interesting.
Yeah. The virus can be transmitted in hot and humid climates. That's not going to prevent it, which, once again, I think that's a heat resistance thing. Cold weather and snow also cannot kill the virus. Taking a hot bath does not prevent the virus.
I wonder if the hot water drinking is on this list. I've seen that a lot. If you drink hot water or gargle with hot water, that you will kill the virus. It's not a thing.
Makes sense.
It's not a thing.
Because your body is like over like 96 degrees.
Yeah.
The virus can't be transmitted through mosquito bites. So that's actually a good myth to bust because it makes me feel better. Because there's a lot of mosquitoes.
Yeah.
Some people think that hand dryers kill the virus.
Oh.
They don't. Ultraviolet disinfection lamps don't kill the virus. Or, well, you shouldn't use them for sterilization. Thermal scanners. They can't determine if you have the virus. They can determine if you have a fever, which is a symptom of the virus.
Gotcha.
So, not completely false, but...
Not true either.
Spraying alcohol or chlorine all over your body will not kill the chlorine. The coronavirus.
Who's doing this?
Vaccines against pneumonia don't protect you against the coronavirus.
Yes. Vaccines against any disease other than coronavirus do not kill the coronavirus. And if you have a vaccine for coronavirus, it is a lie, and do not use it. Do not buy it.
Did you hear about the infamous con artist who was recently released from jail and is now selling the cure for coronavirus?
Oh no.
He's like a religious leader guy.
Oh boy.
Yeah. Regularly rinsing your nose with saline won't prevent infection. Can
Are
help.
you Facebook living?
No, but I should.
That can help make your cold go away faster, but it's not going to prevent the virus. Eating garlic will not prevent infection with coronavirus. It's healthy for you in general, but it's not going to stop you from getting this.
We take garlic pills, like little things of garlic, just for general
Because they're healthy.
health. But yeah, didn't think that it would kill the coronavirus.
That's what a lot of these things are things that are actually good for you. And like, as a general rule of thumb, like, yeah, it's good for you to eat garlic. It's good to take certain supplements, go out in the sun, but
yeah, so it doesn't mean
it's
don't
not
do those
the
things.
cure-all answer, you know?
Right.
Young people are susceptible to coronavirus. They're less likely to have any complications unless they have underlying issues.
Right.
But you're not immune to it because you're young. Antibiotics don't work against viruses because antibiotics are for bacteria and viruses are not bacteria.
But see, that's the weird thing because I've been hearing, even with the hydroxychloroquine, that they're mixing it with
something.
Yeah, well, it's been a couple different things.
Oh.
But they're antibacterials, I think.
Maybe they have both properties?
I don't know. Because they say it makes the viral load much smaller, but it's like that's an antibiotic, so how does it
I wonder
change
if
the
it's
viral
not
load?
directly treating the virus or if maybe it's encouraging your body in some other way.
Right. I don't think they're claiming it's directly treating the virus. I think they're saying it's lowering your viral load. In other words, you are getting better faster,
Yeah.
but not necessarily
Either
directly.
way, if it's helping, it's helping.
But yeah, but antibiotics aren't usually a good thing to be on unless you need them.
Yeah, because that also encourages them to be less effective in general. So, are there any specific medicines to prevent or treat the new virus? No. Not really.
Not.
There's some experimental stuff going on, but nothing conclusive. So, at this point, don't know very much. And that is the list of some of the more common myths. Wow, there's a lot of them.
According to the
World
WHO.
Health Organization.
Yeah. So let's go through medical news today.
Oh boy. I like reading these.
I would hope that this would be the same ones, because I hope there's not more myths.
Oh, here's a whole nother list.
But we'll see.
Okay.
Whole nother.
This one is the same. Don't spray alcohol or chlorine on your body.
Steve? Did Steve release this information?
Probably.
Children can get the virus,
Mm-hmm.
but they're just less likely to so far. Unless they
Less
have
likely
other-
to get it and less likely to have complications. I think only one person
and
or one or two people have died that were under the age of 20,
I think we had our first, I don't know if infant is the right word, but I'm going to use infant death in Connecticut.
That's sad.
Yeah, but they are actually, I think, misreporting that because I think that there were actually health complications involved.
Oh, yeah, I heard about that. There were other health complications involved that were not related to coronavirus, but the infant also tested positive for coronavirus, so they ruled that cause of death. I'll have to look into that more.
COVID-19 is just like the flu. It is not just like the flu.
Yeah, to be clear, COVID-19 being like the flu is the myth.
It's not like the flu. It has flu-like symptoms, so it would be considered. So it can have, it has similar symptoms. And they can both lead to pneumonia, but overall, the flu is a lot less dangerous.
Yeah, that's a totally different.
This is a good myth. It's good that it's a myth. Everyone with COVID-19 dies. False.
Oh my god!
It's not going to kill you for sure.
Yeah. The mortality rate for COVID-19 is actually pretty low.
Yes.
Like, it's still big enough that if everyone gets it, that's a lot of people dying. But as of right now, I think it's below 2%.
Yeah, we're not at zombie apocalypse levels.
No.
Cats and dogs spread coronavirus. Not true. For a while, we thought that they could get infected and they could spread it, but that's not true.
I heard a report of a dog testing positive.
That was not true.
Oh,
It didn't
okay.
test positive. It just had the virus in its nose, but it didn't infect it.
Gotcha.
Yeah.
Makes sense.
So, they're...
So the dog was just carrying it just like any other surface would.
Yeah, so the risk of them spreading it or getting sick from it is pretty much nothing.
Gotcha.
Face masks protect against coronavirus. This is somewhat false. I'm going to read directly from this. Healthcare workers use professional face masks which fit tightly around the face to protect them against infection. However, disposable face masks are unlikely to provide such protection. Because, they don't fit your face very well. There's still a lot of room.
Got gaps.
But yeah, basically the masks that you see most commonly to prevent illness, they're not going to do much. I'm sure that they help to some degree, just like any covering of your face would, but they're not really that effective. And they should be safe for worst case for our medical professionals.
Yeah.
If they absolutely have to use those, even though they're not ideal. Hand dryers don't kill the virus. Oh, this is an interesting one. COVID-19 is a mutated form of the common cold. That is not true.
Oh, the fact that it's a mutated form of the common cold is not true.
Yeah.
Interesting.
Yeah.
Because aren't both from coronavirus though? I'm pretty sure that's true. That the common cold can be caused by a coronavirus, and so can COVID-19.
Well, yeah, because coronaviruses, there's a lot of them.
Right.
This is just a specific one.
Yeah.
It says coronaviruses are a large family of viruses, all of which have spiky proteins on their surface. Some of these viruses use humans as their primary host and cause the common cold. Other coronaviruses can primarily infect animals,
They're kind of loosely related.
they're related, but very different depending on the strain. This is an interesting myth. You have to be with someone for 10 minutes to catch the virus. That's not true.
That seems very arbitrary. You're
I like
like
it.
9:59, better go.
The virus is just like, we're cyclists. The longer someone is with an infected person, the more likely they are to catch the virus, but it's still possible to catch it in under 10 minutes. Once again, rinsing your nose with saline won't stop the virus. Oh gosh, I was waiting for this one to pop up. You should not protect yourself by gargling bleach.
Oh,
Steve.
it is definitely Steve.
There are no circumstances in which gargling bleach might benefit your health.
We should have Steve pop up with his handle
He's there.
so that everyone knows.
He's there, right there.
What?
He just popped up.
Oh, yeah, right. We're not very...
Hi, Steve.
Hi. I haven't met you yet, but hi. Wait. Yes. Sorry. But yeah, so...
She's not sure if she's met you yet, Steve.
Bleach is corrosive and can cause serious damage. If you're not a coward, it won't, but... I'm kidding.
Anything kills the virus if you're brave enough.
If you die, you can't get it.
It's true.
Once again, antibiotics do not stop the virus. Thermal scanners don't diagnose it. They only diagnose fevers. Garlic doesn't directly protect against coronavirus. It just is healthy in general. Parcels from China can spread coronavirus. Not true.
Yeah, because it's
Too long.
it's too long of a journey.
I mean, I guess it's still probably a good idea to wash your hands after handling packages you haven't,
Yeah.
aren't in your home. But it's probably not coming from China if it's there. Home remedies can cure and protect against COVID. Not true. Taking vitamin C, using essential oils, sesame oil, garlic.
Sesame oil.
Yeah.
Interesting.
Fish tank cleaner, burning
Oh.
sage, and sipping water every 15 minutes.
Yo, that's what I've heard.
I have not
Just
heard that one.
drinking water to make sure that it's going down into your immune system
Interesting.
so that your body can kill it. Because supposedly, according to the theory, if it's in your throat, it can infect you. But if you've pushed it down, your immune system will fight it.
I'm gonna try it.
Right.
No, it's wrong. Wrong.
Oh my gosh, this is the funniest one on the list. Okay, this one is sad, but also funny. You can't catch coronavirus from eating Chinese food. That's not true.
Oh,
It doesn't
my
make any
goodness.
sense. If you're not eating there, you're just being kind of dumb. And if you
Eat
were doing
all
that
the Chinese
before,
food.
yeah, if you were avoiding, well, I mean, now you shouldn't be eating anywhere really. But before, if you were avoiding Chinese restaurants, that's not gonna happen unless, I guess, on the off chance the owner went to China recently.
Yeah. But you can order Chinese takeout.
But the reason I thought this was funny is it has the myth, and then underneath the only note it has is no, you can't. You can catch coronavirus from urine and feces. Feel like you shouldn't be touching those either way, but
Yeah, you can catch some other stuff from that probably.
yeah. The virus will die off when temperatures rise in spring. Not true. Well, it's not that it's not true. We don't really know about
Right,
that
it's not
for sure.
definitively true.
So, I mean, it's possible it could decrease in numbers at that point, but we don't know, so don't think that summer is going to kill it.
Right.
This is really sad that some people think this. Coronavirus, the deadliest virus known to man.
Wow.
That is 100% false. Consider Ebola. That had an extremely high death rate. The reason that we didn't do all of this, though, is because it's not very contagious.
Right. Yeah, this is unique in that it's more contagious, so more people will die in that sense just because more people caught it.
Yeah, but it's not particularly deadly.
Mm.
I mean,
It is more deadly than the flu
Yeah.
by quite a bit, but it's still not, it's not levels of other pandemics that
Yeah.
we've had or anything like that.
Flu and pneumonia vaccines protect against the virus. That is not true. The virus originated in a laboratory in China. Despite all of the rumors, there's no evidence that this is true. In a recent study demonstrates that the virus is a natural product of evolution. So yeah, probably didn't come from a laboratory in China because there's no evidence of that.
Yeah.
But
it could have.
Maybe.
I'm just kidding.
But
I
only
do
evidence
wanna-
is that there is a lab
Right.
where it originated,
Yeah.
and they were studying certain strains of coronavirus, I believe.
Yeah.
But
yeah,
it
I
doesn't mean it
definitely
came
want
from there.
to. I definitely want to dive into that and kind of look at the rumors.
Got one more on here, and I definitely heard this at the very beginning before this was even widely talked about. The outbreak began because somebody ate bat soup. Yeah. No. Scientists are confident the virus started in animals, but there's no evidence it came from soup of any kind.
Interesting.
Yeah, so those are some of the most common myths busted.
Oh, okay. So then I want to go into some other more deep myths, I guess. First of all being that coronavirus isn't a big deal.
Yeah,
That's
definitely not a big deal.
It's
Thousands
definitely-
of people haven't died from it.
It's a big deal. I just feel like even in the beginning stages, like if 100 people that you knew died, you would be like mind blown, devastated. So why is it that when 1,000 people in China die, we're just like, oh, no big deal. It's not a thing.
It's just the Chinese.
Yeah, it
like-
doesn't matter. And then even once it got to America, you still saw people going out, having
Yeah.
parties, birthday parties, gatherings. Like,
Mhm.
it was just really weird, especially once we knew what was going on, that people were still kind of like, it's spring break. I'm going to go travel and
I've
lick
been planning
toilets.
this trip for months, you know?
Yeah.
I'm gonna go.
Like, it's really messing up with my spring break. 'Cause what is there to do here other than go to the bars or the beach, and they're closing all of it? It's really messing I think they're blowing it way out of proportion. I think it's doing way too much.
And I do think the whole world is probably looking at us right now thinking of what a massive mistake that we're making. It's not what we should be doing, but
So, definitely a big deal. We
Yeah.
should take all life seriously, even if it's 2 people or 1 person.
Yeah.
Like,
I mean,
I
if
don't
we can
understand.
prevent it, we should.
Yeah, if, like, at what number does it become a big deal that we should care about it? So, like I said, we all kind of know people who are shrugging it off, especially back in February and early March.
Yeah. The news cycle was very distracted in those months. People weren't really hearing about it. So.
Right. I think they were still talking about impeachment, and it wasn't really getting covered by the news.
Nobody was really concerned about it at that point, except for a select few people.
And the Chinese people.
They were like, guys.
So maybe people are being flippant because they think it's just unavoidable. You know, it's going to happen anyway, so why should I change my behavior?
Yeah, till July sounds like a bunch of bullshit. I'm sorry. But, like, it's a virus. I get it. Like, I respect it. But at the same time, like, even if everybody gets it, like, yeah, people are gonna die. It's just terrible. But, like, inevitable? I don't know. Maybe I shouldn't be doing this right now.
That sounds familiar.
Maybe I'll play a clip. Or maybe like tons of other things kill even more people. A lot of people have been like, you know, why are we shutting down over this? We don't shut down over car accidents. Yeah. Like that's kind of a false thing to compare it to, because we have to keep transporting ourselves. And we can't stop that.
Something I think is that every time something like this happens, people are going to say that, but the more of the things that pile on top of each other, the more people will die. Now, often the same amount of people or the same group of people would be affected, but it's still compounding every time we don't. Did that make sense? It didn't make sense.
Every time we don't.
Every time we don't, it's compounding.
Wait, try again.
Okay, what I'm trying to say is, so you could say, oh, well, heart disease kills X amount of people, and you could say car accident kills this many people, and, you know, cancer kills this many people. So why is this virus so important? Because this virus is killing even more people.
Right. It's compounding. And like you said, with people who have underlying risks that were already at risk, it's just compounding that risk. And because this virus is so new and we have the opportunity to mitigate a lot of the spread, why not? Like, we're saving tons of lives. I mean, think if every American got infected and it was that 2% mortality rate we were talking about, that's millions of people, which is unrealistic. I don't think that number would be realistic because some people are automatically gonna not catch it, not spread it, whatever. But it would still be pretty significant. I think it would still be in the millions, or at least 1 million, if we did absolutely nothing. So, for whatever reason, coronavirus is a unique virus that makes it more dangerous regardless of how small you might consider the mortality rate. It's contagious before and possibly after symptoms are present, and that makes it really easy to spread. And the truth is, we as a people have the power to mitigate this spread, and that means reducing the number who catch it, reducing the number who die. Even if we only saved 1,000 people, or 100, or 10, or 1, that might be worth it. I don't know, because it's too complicated to say let's do that at all costs, because then other people could die from suicide, from being completely isolated. You know, there could be other repercussions that we're not thinking of.
There's a lot of things that I've had, you know, like brought to my attention, you know, that it affects that, you know, you didn't really think about.
Right. So you can't really say that's worth it to save one person, but my point being, you know, let's do everything we can within reason, because this is making a difference. While the majority of patients experience mild symptoms, approximately 14% experience severe disease and 5% fall critically ill. That's what the WHO said. A professor, which I've linked to, also said that the average person who gets a common influenza strain infects 1.3 people. So where I would normally infect 1.3 people with the flu, and then each of those people would branch off and infect 1.3 people, you would get if you went on 10 people, you would infect a little under 14 people total. You would be responsible for spreading it to 14 people. Now, 3 people doesn't sound like that much more, but when you get to that power of 10, you are infecting over 59,000 people.
Normal flu, if I get that, I'm going to infect, on average, about 1.3, 1.4 people, okay, if there was such a division.
Yeah.
And if those 1.3, 1.4 people gave it to the next lot, that's the second time it gets passed on. By the time that's happened 10 times, I've been responsible for about 14, cases of flu. This coronavirus is very, very infectious, so every person passes it to 3. Now, that doesn't sound like much of a difference, but if each of those 3 passes it to 3, and that happens at 10 layers, I have been responsible for infecting 59,000 people. But please just remember that the best chance we can give for the people who do fall ill is if we've got enough beds and enough staff and enough kit to be able to be there for you. And if you are irresponsible enough to think that you don't mind if you get the flu, remember it's not about you, it's about everybody else.
Exponential growth is something that people don't really consider until they hear the numbers.
Right, so staying at home matters, because if you're that person that's going to infect 59,000 people, or if you're that person that got infected by the first person, you could change it by another 1,000. I don't know the exact math, but it's a big deal. The fact that thousands of people die every day is no excuse to take zero action in the face of something that we can effectively change. The reality is we can't stop people from dying in car accidents. It would require never driving a car again, and that's not an option, but we don't have to keep getting coronavirus. The action we can take here is possible, and it is short term, because we just need to buy time for there to be a vaccine or some sort of medicine that will help. And we're buying time for the hospitals to prepare, buying time for everyone to get all the supplies that they need. And you could say it's not a big deal now because millions of people are taking action, but imagine if everyone had that flippant attitude. Like, imagine if the president were like, which I mean, some people claim he was, but imagine if the president didn't close our borders or didn't screen travelers, or, you know, if we didn't have people saying, hey, let's stay home, and that didn't spread, you know, we would be in a very different place. Life is much more complicated than it can be shown on graphs, but it does just make logical sense that this virus will spread significantly more slowly if we don't touch other things, if we're not around other people, if we wash our hands. You know, it just makes sense.
I mean, I know it's difficult, but we're having a lot of suffering, a lot of death. This is inconvenient from an economic and a personal standpoint, but we just have to do it. That is our major weapon against this virus right now. We don't have a vaccine that's deployable. This is the only thing we have, and we can get through it if everybody really leans forward and pushes on this.
But as important as it is to abide by the guidelines and help mitigate the spread of the virus, we don't want to spread fear and this like apocalyptic outlook, which brings us to number 2. The second myth is that coronavirus is a huge deal and no one is helping and we need to panic.
Which surprisingly is one of the most common myths that I've heard.
Yeah.
Everybody is panicking, and on top of panicking, people are like, guess what? Nobody's doing anything.
Right.
We're all gonna die. You know?
Yeah, they think no action's
not a
being
good
taken.
mentality or true.
Right. So there's been a lot of disastrous headlines. This one from NBC, so many patients are dying, doctors say NYC public hospitals reeling from coronavirus cases. CNN says trauma physician treating coronavirus patients worries we are slowly descending into chaos. In New York Times, 13 deaths in a day. This is an apocalyptic coronavirus surge at the NYC hospital. Vanity Fair says New York coronavirus deaths are reaching apocalyptic heights.
I think the Forbes one is my favorite.
Forbes. Well, here, I'll read NBC first. Dr. Brooks predicts up to 200,000 U.S. coronavirus deaths if we do things perfectly. Almost perfectly.
My favorite Forbes headline is, if coronavirus takes hold in the U.S., it will be more than a retail apocalypse. It'll be Armageddon. I love Forbes. They're always just
really extreme.
Yeah, and everything.
Yeah, so there's a lot. I honestly feel like there's some that I've seen that are even more extreme and I just can't find them now. I feel like going back in time, like, I feel like they're gone. I could just be crazy. I'm not saying
hard to find or
I'm not saying they deleted them, but it's hard to find. But yeah, I'm tired of the news playing on people's fears and acting with agendas or bottom lines in mind. The White House has called on guidelines and real numbers and real information and hope to be spread. They say that in so many press conferences. They're like, please put this out in your publications.
And the news is like...
yeah, and they're like, we're going to do a hit piece. And instead, we're getting like borderline fear mongering, and we're seeing misinformation going viral and unchecked. Vox, I assume that's how you say it, had one article titled "Fauci predicts over 100,000 COVID-19 deaths in the United States," and just under that it says, "We're going to have millions of cases." Technically true. But it continues as follows, and they quote Fauci saying, "I don't think that we really need to make a projection because of the uncertainty inherent in the forecasting enterprise. But he did say that looking at what we're seeing now, I would say between 100 and 200,000 deaths, we're going to have millions of cases." Fauci's comments follow the warning from the White House coronavirus response coordinator Deborah Birx on NBC's Meet the Press Sunday morning that, quote, "no metro area will be spared." Later, they say these contrast with messages from President Trump, who started talking about relaxing social distancing measures a few days ago while setting the goal of reopening the country by Easter, and that's striking. They quote Trump saying Trump's view that we cannot let the cure be worse than the disease, and emphasis on the need to strike a balance between public health and the economy is very different from Joe Biden's message over the weekend, which stresses the need to listen to public health experts and tell the public the truth, implying that we are currently not listening to experts and not telling the truth, I guess. This is great. Most recently, when confronted on the disconnect between her words and the president's, Birx just pretended to believe that Trump is quote, "so attentive to the scientific literature and details and data." They're literally just making an interpretation up. Like, they're just saying that Birx pretended.
That's my favorite thing reading articles about this has been not even just, somewhat, it's kind of biased because they believe something. It's just straight up placing this extreme bias on literally everything.
Right.
Taking statements that somebody says and implying that they're not true.
Right.
Just because they don't want them to be.
Yeah. And I like the ending too. "The facts as conveyed today by Birx and Fauci are, however, extremely sobering and suggest we are not even close to putting the darkest phase of the current crisis behind us." And then they also have an article, same people. It says, "The interview's key moment came when Todd said scientists believe it may take until June before the U.S. is in a position to start relaxing social distancing." And he's quoted, this is Todd, the interviewer, saying, "You're certainly hearing scientists say that an occasional governor will say, Dr. Fauci might even say that," referring to the fact that it's going to be going through June. "But you don't hear a consistent message nationally. How would you convey that to the American people, basically telling them another 60 days of home confinement?" And then they quote Biden, who says this, "Look, the American public is really strong and tough. The first thing we should do is listen to the scientists," as if we're not already doing that. And I want to point out, too, that Fauci has not said that we're going to have 60 days more of home confinement. As a matter of fact, he has repeatedly said he thinks this is going to peak in April, although we can't definitively say that. That's what he thinks is going to happen.
We're already in April, so we're on our way to find out if that's true.
Right. So he says, Biden says the first thing we should do is listen to scientists. We're already doing that. Secondly, we should tell them the truth. The press conferences are so, great about being factual and honest. It's actually really surprising. The only thing that I don't like is sometimes if they don't have a direct, perfect answer, they'll kind of talk around the subject and, say what they do know, rather than just say, "I don't have an answer for you," which bothers me. But here we are. Then Biden says, "The American people have never shied away from being able to deal with the truth. The worst thing you can do is raise false expectations and watch them get dashed. Then they begin to lose confidence in the leadership. So we should just tell the truth as best we know it, as best the scientists know it, and we should let them speak," the scientists. Biden then repeated his call for the president to set free market dogma aside and invoke the Defense Production Act. I don't know when this was written. I'm pretty sure Trump has invoked that.
I believe he's invoked it, but he's not using it because it has not needed to at this point.
Right, because companies privately have stepped up and started producing.
They've been volunteering to help.
And then this is Biden's advice to Trump. "You should focus on making sure," remember earlier it was all about health officials and, Trump's not doing the right thing. Now he's saying you should focus on making sure we're in a situation when we're able to see to it that unemployment benefits can get to the people. What is the IRS doing to get those $1,200 checks to people? That's where focus should be, and it should be laser focused. That's not focused on the coronavirus at all, which I feel like
is a direct contradiction to his previous statement.
Right. I don't think we should be laser focused on paychecks.
I think we should be focused on trying to find a cure.
Right. I mean, it's all important, but...
Yeah, it definitely needs to be in conjunction with each other, but we can't just pick one half of the equation and focus on that. We have to balance.
Yeah. And as of right now, if you look at the caseload, it's not great. It's not wonderful. Like, I mean, that's a lot of people being affected. But when you look at it in the light of our population, it's really not that many people.
Yeah.
Like, they're important people, and that shouldn't be, ignored. But the fact that we're still this low with this many people in our country, it's kind of crazy to me. Because New York has 75,000, almost 76,000 cases as of today, or as of last reporting. But they have 19.54 million people in New York, and they have almost half of our cases.
Yeah, so saying 76,000 cases sounds scary, and I mean, that is a big number, but put in proportion to the, 19 million, well, 19.5 million people there, it's not as significant.
Yeah, and we have 350 million people in all of the U.S. and only 188,000 cases. So
we have 330 million people.
I think it's 350 million as of 2019 and 330 as of 2018.
I'm interested to see the results of the 2020 census.
So I'll need to check out the most up-to-date news, but as of a few days ago, Birx was saying in a conference that there's no evidence of lack of hospital beds. There is a lack of supplies that we've heard about anecdotally, but they're not seeing a lack as far as people saying, I'm running out of this stuff. It's more individual stories. So I think that could be a problem on a more local level, although I don't know, this was a few days ago, so that could have changed. PPE might be running a lot lower now.
Yeah, it was very interesting to me. This was a little while ago, but I was watching the news and can't remember who said it, but they were basically, this was right before a press conference started, and somebody was saying, New York hospitals are running out, they're ready, they're reaching apocalyptic, this is, I can't remember the exact words, but basically implying, this is horrible. And then directly after, in the press conference, I think it was Dr. Birx, she was like, there are beds free in New York, and not that there isn't an issue, but we are blowing some of it out of proportion.
Right. Yeah, it's definitely an issue, but the thing is, they've seen it before it's become a dire need. They've put in pop-up hospitals, they've sent ship hospitals, they've held off dental and elective surgeries so that frees up the PPE and that frees up the beds, and it's just they're really focusing really well and trying to mitigate that dire need that you're seeing in Italy, where people are actually not receiving care because there's not enough to go around.
They're having to choose who to treat.
Right, and even if we did get to a more dire need, we can spread, because it's in these metropolitan areas and these really condensed areas, they have room around them also. It'll take more effort, but they can get around. So yeah, as of right now, we're not anywhere near the horrible situation that Italy is seeing, or anything worse than that for sure.
Yeah.
Do you have anything more to say on that?
No, not particularly.
Okay, so this is myth number 3. This is very short. Myth number 3 is that Trump refused coronavirus test kits from the WHO. This one comes from Joe Biden.
Oh.
I feel really bad because that man needs a break. But he falsely claimed this. As far as anyone knows, this claim is completely unsubstantiated.
There's
no
evidence.
None whatsoever. The WHO did provide test kits to many countries, but the Coronavirus Task Force claims that none were offered to the US ever. And even if they had been, they would have had to go through our quality control, and they may not have even met that. I think they were talking about how previously there were a lot of false positives, false negatives, and we don't want that because, like Dr. Birx is always saying, we need good data so that we can make good decisions. Because if we don't know the real data, we're getting false positives, false negatives, that totally ruins.
Yeah, so there was some delay there because we didn't get any, and also we wanted to have stuff that worked.
Right.
But now I believe that our country is testing the most in the whole world. So.
Yeah. I think today I heard Mike Pence say 100,000 people are getting tested every day.
And that started from, I think, a few weeks ago.
Which
right?
is crazy. I don't know. I watched all of the press conferences through, and more than just press conferences. I watched the meetings, I watched the appearances through March 23rd, and then I've also watched 2 since then, I think. So I don't know the super up-to-date information. But, so here's another one that's kind of older. Myth number 4. Trump thought coronavirus was a hoax. That's completely wrong. And
I've seen this everywhere. I'd say 90% of people's criticisms of him that's probably an inaccurate number, but most of the criticisms of him have basically been people saying, well, he doesn't even think it's real.
Right. And that's hugely person to person. That's not just news outlets.
Yeah.
News outlets have actually retracted this. They're starting to kind of say...
Even if you look it up on fact-checking sites like Snopes, they're like, this is... I think the rating is partially true.
It's partially true just because he called something a hoax. But yeah, even the more liberal-leaning media is starting to say
they're like,
that's not what he meant.
Reported.
So here's some headlines from Politico. They had Trump rallies his base to treat coronavirus as a hoax. From National Review, they said Trump and the coronavirus hoax. But again, this is something I saw mostly on social media, just people believing this.
Yeah.
Which is the craziest part to me.
Yeah.
Like,
it's just people just believing it.
Yeah. So the claim is that Trump called coronavirus a hoax during his rally in South Carolina on February 28th. And you can actually watch this whole rally and any other press conference, anything like that, on C-SPAN's website really easily. So on February 28th, and I'll show this on the screen, I'm cutting a lot out because he goes on tangents so much.
He has a very interesting speaking pattern.
I think it took him like 8 minutes to say this. So this is precisely what Trump said. Now the Democrats are politicizing the coronavirus. You know that, right? Coronavirus. They're politicizing it. And this is their new hoax. We have 15 people in this massive country with coronavirus. We could have had a lot more than that. So far, we have lost nobody to coronavirus in the United States. Nobody. And it doesn't mean we won't, and we're totally prepared. It doesn't mean we won't lose people to coronavirus. We're prepared for the absolute worst. You have to be prepared for the worst, but hopefully it will amount to very little. We have to take it very, very seriously, and that's what we're doing. We're preparing for the worst.
So does that sound like he's denying that this is real?
No. I mean, like, not only is he not denying it, he's not saying it's a hoax, he's saying we have to prepare for the worst.
Yeah, and I think, it's pretty clear, at least to me, that he's talking about the politicization around...
Yes.
Around it.
He's talking about the spin and all of that. That's their new hoax, that he's not addressing it, like literally what they're doing about this thing. That's what he's calling a hoax. So, myth busted. Myth number 5. People are dying because of Trump's dangerous advice about hydroxychloroquine.
This is my favorite one.
I've literally seen family members saying like, oh, he's killing people with... And I'm just like, no.
I've actually been pretty impressed with, like, a lot of people knowing that this isn't true. Because,
like, reading comments?
Yeah, because I remember on Now This, they posted a video, one of their news pieces on him literally misleading people and killing them. Mm-hmm. And I noticed that the majority of the comments were people like, come on, man, I hate Trump, but he clearly didn't say that. And I was like, most of them. They were like, normally you're an accurate source and we like you, but this is clearly untrue. And I was like, well, I think a lot of people know this is untrue.
Yeah.
But a lot don't, apparently.
A drug called chloroquine. And some people would add to it hydroxychloroquine. So chloroquine or hydroxychloroquine. Now, this is a common malaria drug. It's also a drug used for strong arthritis. Somebody has pretty serious arthritis. Also uses this in a somewhat different form. But it is known as a malaria drug, and it's been around for a long time, and it's very powerful. But the nice part is it's been around for a long time. So we know that if things don't go as planned, it's not going to kill anybody. When you go with a brand new drug, you don't know that that's going to happen. You have to see, and you have to go long test. But this has been used in different forms, very powerful drug in different forms. And it's shown very encouraging, very, very encouraging early results. And we're going to be able to make that drug available almost immediately. And that's where the FDA has been so great. They've gone through the approval process. It's been approved. And they did it. They took it down from many, many months to immediate. So we're going to be able to make that drug available by prescription or states. I spoke with Governor Cuomo about it at great length last night. And he wants to be right on the, he wants to be first on the line. And so I think that's there's tremendous promise based on the results and other tests. There's tremendous promise. And normally the FDA would take a long time to approve something like that. And it was approved very, very quickly, and it's now approved by prescription. Individual states will handle it. They can handle it. Doctors will handle it. And I think it's going to be great.
Let me tell you about a few things that we're currently working on. And this is a plan that was developed with many of the people at this table, our infectious disease experts on the task force. In the short term, we're looking at drugs that are already approved for other indications. So they're already approved, as the president said, for other diseases. As an example, many Americans have read studies and heard media reports about this drug chloroquine, which is an anti-malarial drug. It's already approved, as the president said, for the treatment of malaria as well as an arthritis condition. That's a drug that the president has directed us to take a closer look at as to whether an expanded use approach to that could be done to actually see if that benefits patients. And again, we want to do that in the setting of a clinical trial, a large pragmatic clinical trial, to actually gather that information and answer the question that needs to be answered and asked and answered.
So here's what happened, if you don't already know. So this hydroxychloroquine thing totally blew up in his face. He heard some positive anecdotal evidence about one drug, and I think they were already planning on doing a clinical trial of it in New York. I highly doubt that Trump found this himself and was like, hydroxychloroquine. I'm pretty sure they were already gonna do something. He wasn't just like, let me spin the wheel of medicine. Oh, that's it. So he's been talking about it before this happened, about Cuomo wanting this in New York. He was like, I want to be in first in line.
I thought it was weird. I actually heard the name of the drug from Elon Musk before I heard it from Donald Trump.
Oh, weird.
Yeah.
So it's already been approved for malaria, rheumatoid arthritis, and lupus, and we already know the risks and side effects, which is what Trump has been saying over and over. He's like, this is safe because we already know the side effects. We already know it's not going to kill anyone, as opposed to inventing a new drug for coronavirus that needs to be tested for a long time because we don't know the side effects. So that's why he kind of jumped on this bandwagon really quickly.
It's really good that we already know kind of the side effects.
Right, and we've had a non-clinical study that pointed to it helping people get better, especially when used in conjunction with some antibiotics.
And lots of people are saying that that is untrue because there's another study that, stated that it wasn't true. But that was also a non-clinical study.
Right. You can't say this non-clinical study isn't legit because it's not clinical, and here's this non-clinical study that proves it.
Yeah, so really there's not a lot of decisiveness around this. Some people have been saying, yeah, this helped me. I was on the verge of death, and this
anecdotally it sounds great.
Yeah, but we're not sure yet.
Yeah. So I'll play some clips of his comments so you can kind of hear what he was saying. Generally, it kind of seems like he's just like, I feel good about it. Let's do it.
He specifically said that at one point. He was like, listen, I have a good feeling about this, that's just, and that's what he left it.
I'm a smart man.
Yeah, I'm a smart guy. He sounded more like the Godfather.
Yeah, whatever. So I'll play some of his comments.
We're going to see what happens. We're going to be talking to the governors about it, and the FDA is working on it right now. The advantage is that it has been prescribed for a totally different problem, but it has been prescribed for many years, and everybody knows the levels of the negatives and the positives. But I will say that I am a man that comes from a very positive school when it comes to, in particular, one of these drugs. And we'll see how it works out, Peter. I'm not saying it will, but I think that people may be surprised. By the way, that would be a game changer. But we're going to know very soon. Maybe and maybe not. Maybe there is, maybe there isn't. We have to see. We're going to know.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so.
The preparedness right now.
No, I don't think so. I think that I think it's got
the not yet approved drug.
Such a lovely question. Look, it may work and it may not work. And I agree with the doctor, what he said. May work, may not work. I feel good about it. That's all it is, just a feeling. I'm a smart guy. I feel good about it. And we're going to see. You're going to see soon enough. And we have certainly some very big samples of people. If you look at the people, you have a lot of people that are in big trouble. And this is not a drug that obviously, I think I can speak from a lot of experience because it's been out there for over 20 years. So it's not a drug that you have a huge amount of danger with. It's not like a brand new drug that's been just created that may have an unbelievable monumental effect, like kill you. We're going to know very soon. And I can tell you, the FDA is working very hard to get it out. Right now, in terms of malaria, if you want it, you can have a prescription. You get a prescription. And by the way, and it's very effective. It works. I have a feeling you may, and I'm not being overly optimistic or pessimistic. I sure as hell think we ought to give it a try. I mean, there's been some interesting things happened and some good, very good things. Let's see what happens. We have nothing to lose. You know the expression? What the hell do you have to lose?
People attacked him for these misleading comments, and I kept hearing people talking about how Fauci had to get up and correct him. That was so funny, because this is all I heard. Like, I don't get my news from watching CNN or Fox. I don't get my news from normal avenues. I just see like what people post on Facebook. Yeah. So obviously I know that's not super accurate.
Not that watching any of the news outlets seems to be any
True.
better.
But I kept hearing like, oh, Fauci had to get up and stop Trump from misleading America. And like, where's Fauci? We need Fauci. And then I watched the press conferences and that's not what happened.
It's a strong drug, so we'll see.
Fairly effective against SARS.
It was, as I understand that, is that a correct statement? It was fairly effective on SARS.
John, you've got to be careful when you say fairly effective. It was never done in a clinical trial that compared it to anything. It was given to individuals and felt that maybe it worked. So
but was there anything to compare it to?
Yeah, well, that's the point. Whenever you do a clinical trial, you do standard of care versus standard of care plus the agent you're evaluating. That's the reason why we showed back in Ebola why particular interventions worked.
As a matter of fact, I think the incident they're referring to is when a reporter asked Trump a question about the efficacy of the drug against SARS. And Trump says, and he goes, I understand, because the guy was like, is it effective against SARS? And the guy's like, I understand that, Fauci, is that true? And he like kind of stops himself and then he's like, I understand that it's effective against SARS. And then Fauci jumps in and he tells the reporter to be careful. He's not like, oh, Trump, be careful with what you're saying.
Trump, you fool.
Like, Trump turned to him and wanted his advice. He wasn't saying, like, this is effective. And Fauci pointed out anecdotal evidence. We can't say anything definitively, but there's anecdotal evidence. Like, there's something to that, but there needs to be a balance. Like, we need to understand that it's not proven. And he did not advise, he being Trump, did not advise anyone to start taking the drug.
It was more tell your doctors, but ask about it.
Right,
You know?
and he was like, we want to start, approving this for people to be able to take it. It's a whole right to use thing. So then an older couple who's watching Trump realizes that their fish tank cleaner has chloroquine in it.
They were like, wow, we have the best idea.
And they eat the fish tank cleaner.
And
it's
surprise.
It's not funny. It's really sad and devastating, but at the same time, it's funny that people looked this as like, oh, Trump did this, Trump advised this, because who honestly is going to look at their fish tank cleaner and relate that to a drug that the president is talking about?
I'm not saying that this is like false or anything. That was the wrong word, but I'm not saying like trying to make light of the situation. But who listens to or hears a comment about a potential medicine that might help and then starts looking through their household cleaning products to see if that's in it?
Like, this is a 1 in a million thing. It's a 1 in a million thing.
Most people are not going to be doing that.
Yeah. And then I later saw an article stating the FDA-approved trials. The FDA-approved trials were having a hard time finding people to partake in their study. I assume because they had heard all the news about people dying from hydroxychloroquine.
That is an example of biased and, basically biased media and people being biased towards, that's an example of biased media literally affecting the health of others.
Right.
In a tangible
I
way.
mean, if it doesn't work, yeah, it didn't make a difference. But they risked that.
Yeah.
Like, it could have worked. It might still work.
Yeah.
And they're putting that on the line because they're willing to scare people out of using it just to paint Trump in bad light.
Yeah.
And it's kind of ironic given that their whole argument is that Trump is giving misinformation.
Yeah.
So in response to a reporter asking about Trump's comment on chloroquine, Fauci actually said, quote, "If you really want to definitively know if something works, you've got to do the kind of trial that you get good information. The president is talking about hope for the people, and it's not an unreasonable thing to hope for the people. So when you have approved drugs, the physicians have the option and a decision between the physician and the patient. Are you going to use the drug that someone says from anecdotal standpoint, not completely proven, but might have some effect? There are those who lean to the point of giving people hope and saying, give the person the option and having access to that drug. My job is ultimately to prove without a doubt that a drug is not only safe, but that it actually works. But those two things are not incompatible when you think about that, particularly when you're in an arena where you don't have anything that's proven."
Yeah.
Like
this
at
there's
some
not a
point,
different option.
right, at some point we have to start trying stuff.
If somebody's in a bad place and they don't have much hope, of course they're going to want to try something.
Yeah. So the FDA actually, it did not approve. This is different than approval.
Yes.
The FDA did an emergency use authorization, which means people can start to get hydroxychloroquine. A lot of governors and other officials have made it a little less accessible because a lot of doctors they found were actually withholding the drug from people who regularly use it for lupus or rheumatoid arthritis or malaria. They're withholding the drug and saving it not for coronavirus patients. They're saving it for themselves and for people who are afraid of getting coronavirus, using it preventatively.
Which is there's not any evidence that that's...
Right, there's no evidence that that works at all, not even the anecdotal. So that was an issue. So they kind of had to, mitigate that a little bit. So a lot of governors are stepping in and addressing that. But specifically with New York, they're actually doing a trial. Like they're pulling data from these New Yorkers. They're not just getting experimented on or anything. Which was funny because I like the headlines about all of this. There was Forbes, man dead from taking chloroquine product after Trump touts drug for coronavirus. BuzzFeed, a man died after self-medicating with a form of drug that Trump promoted as potential treatment for the coronavirus. CBS, Arizona man dies, wife ill after taking drug touted by Trump. The New Yorker, Trump's dangerous messaging about a possible coronavirus treatment. All of these are making it sound terrible.
Yeah, they're almost directly lying.
Yeah,
almost.
And almost. They're very close. They know they can't directly lie, quite. CNN said, fact check, Trump again touts unproven drugs for coronavirus and other misleading statements.
That's so funny because I bet that they actually debunked it in the article. Did they?
I don't know. I'd have to read it.
But it's still, even if they were actually fact-checking that and saying it's untrue, the headline still implies that he did.
Right. That's the thing. People pick headlines that are divisive and out there. And then in the article, they're a little bit better, but they know people are getting their news from headlines. Yeah. But my favorite one, Trump keeps touting an unproven coronavirus treatment. It's now being tested on thousands in New York. like
it's
Trump
like they're trying to provide good news and also bash Trump at the same time.
They were like, oh, Trump just picked this thing and now they're using New Yorkers as test rats. Like, it's just weird. Especially because Governor Cuomo was like ready for this.
Yeah,
like,
a lot
he
of
wanted it.
People of different political leanings and stuff have been working very closely with the president and been very reasonable.
Yeah, and he said a lot that there's been a lot of bipartisanship? Non-partisanship.
Yeah, non-partisan. Yeah, but yeah, a lot of people on all sides of political spectrum have actually been stepping up and working really well with this. I think Newsom was saying that he's the governor of California.
Right.
Obviously Democratic. And he was like, listen, you know, we're working together. This is going well. You know, we're making progress. And I think Cuomo's been pretty good too.
Yeah. I really want to look into, in the future, de Blasio with Trump, because I know he said some pretty divisive things, but then Cuomo has been working closely with Trump. So I don't know, like, what the relationship
it's kind of a
is.
weird dichotomy going on.
Yeah. So
nobody really likes de Blasio, though. Like, on any side. I mean, he killed a groundhog, which, honestly, I feel some sympathy, because if I accidentally dropped a groundhog and killed it, I would probably be devastated.
yeah.
But still, he killed a groundhog.
Oh, man. So that was all the myths I had for today.
Yeah.
In the next video, I'd like to explore the entire timeline of this epidemic, which is going to take some time.
And yes,
yeah.
consuming.
And I really want to discuss what to look for when trying to decide if a piece of news is reliable. So looking at, you know, how do we weigh whether data is represented accurately? How are reporters posing things just to kind of get our wheels turning a certain direction? Really just kind of looking at what to spot.
Yeah, which that's something that both of us are getting a lot of experience with researching this. Because you gotta learn how to spot facts and biases on all sides.
And I also want to break down some more viral topics that we've been seeing on social media news outlets next week too. We just couldn't get to all of them today.
But for now, that's all.
That's all, folks.
What do you say to Americans who are scared, though? I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. Go ahead. I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism, and the same with NBC and Comcast. I don't call it Comcast. I call it Concast.